An unexpected hero in the fight against anxiety is quietly making waves, and it's a heart medication you might not have guessed. Beta blockers, a class of drugs originally designed to treat heart conditions, are now gaining popularity as an off-label remedy for anxiety, sparking a notable increase in prescriptions. But here's where it gets controversial. Should a medication meant for the heart become a go-to for mental health struggles? Beta blockers, with propranolol being the most well-known, were first approved by the U.S. Food and Drug Administration back in 1967 to manage cardiovascular diseases, particularly high blood pressure. Fast forward to today, and these drugs are being prescribed more frequently for anxiety-related issues. According to global data from IQVIA, cited by the Wall Street Journal, prescriptions for propranolol have surged by 28% since 2020. Celebrities have played a surprising role in bringing beta blockers into the spotlight for anxiety relief. At the 2024 Academy Awards, actress Rachel Sennott openly recommended the drug on the red carpet, saying, "Take that beta blocker, girl, swallow it down and lock in, numb is in." Similarly, Paige DeSorbo, a TV personality and co-host of the Giggly Squad podcast, shared her personal experience with beta blockers during a September 2024 episode. She revealed how the medication helped her manage her first intense panic attack while on tour, allowing her to perform without being overwhelmed by anxiety. So what exactly are beta blockers, and how do they work? Dr. Daniel Amen, a psychiatrist and brain imaging expert who founded the Amen Clinics in California, explains that beta blockers function by calming the body's stress response. They block the effects of adrenaline, the hormone responsible for the fight or flight reaction, thereby slowing the heart rate, stabilizing breathing, and reducing physical symptoms of anxiety such as trembling hands, rapid heartbeat, and racing thoughts. Dr. Amen emphasizes that while he initially encourages patients to try natural anxiety-reducing techniques, like diaphragmatic breathing, meditation, hypnosis, and mindfulness, sometimes these methods aren't enough. Your nervous system can override your best coping strategies, he says. That's when beta blockers can step in as a powerful aid. Importantly, beta blockers don't sedate or dull your mind. Instead, they help quiet the false alarms your nervous system sends when it mistakenly perceives danger, giving you control over your body so your mind can catch up. Think of it as hitting the pause button on your body's fight or flight response, allowing clearer thinking and better performance in stressful situations. Beyond anxiety, beta blockers are widely used to treat other conditions such as migraines, tremors, irregular heart rhythms, and to protect the heart after events like heart attacks. This versatility adds to their appeal, but also raises questions about their expanding role in mental health treatment. Of course, no medication is without potential side effects. Dr. Amen points out that beta blockers don't cause cravings or withdrawal symptoms like some other anti-anxiety drugs. However, some people might experience fatigue initially, though this usually fades over time. He also advises caution for individuals with asthma, diabetes, or certain heart conditions, as different beta blockers may be more appropriate depending on the person's health profile. A critical safety note: beta blockers should never be stopped abruptly if taken regularly. Gradual tapering under medical supervision is essential to avoid complications. When prescribed thoughtfully, beta blockers are considered very safe, well-tolerated, and non-addictive. Dr. Amen often recommends them as a first-line treatment for performance anxiety, public speaking fears, or other situations where physical symptoms of anxiety can be debilitating. For the right person, beta blockers can be life-changing, he says, sharing stories of patients who have successfully used the medication to deliver TED Talks, pass important exams, perform on stage, and face major life events with newfound confidence. The recent celebrity endorsements have helped destigmatize the use of beta blockers for anxiety, which is one of the most common mental health challenges today. Yet, Dr. Amen stresses that these medications are not magic pills. They work best when combined with healthy coping strategies, such as breathing exercises, challenging negative thought patterns, and maintaining a brain-healthy diet. So what do you think? Is it time to rethink how we approach anxiety treatment, embracing medications like beta blockers alongside natural methods? Or should we be cautious about expanding the use of heart drugs into mental health without more research? Share your thoughts and experiences in the comments below. This is a conversation worth having.